Welcome, everyone, and thank you for joining us for today's webinar presentation, Safety Up, Cost Down, Putting Results First. Today's presenters are Cassandra Friedberg, Supervising Department Analyst at Kern County, Lieutenant Ian Silva, Detention Lieutenant at Kern County, Benjamin Fulton, an Associate at the Pew Charitable Trusts, and Amalia Mejia, Realignment Program Coordinator here at CSAC. Cassandra Friedberg is the project manager for Kern County's Results First program. She supervises basically everything having to do with data at the department. She holds a Bachelor's of Arts in Criminal Justice and a Master's degree in Public Administration from CSU Bakersfield. Lieutenant Ian Silva has been in Kern County Detention for 17 years, and in addition to facility operations, he served as a compliance officer, in-service and academy instructor, and as the commanding officer of the detention's tactical team. In November 2015, he took command of the population management section, which coordinates inmate programs. Ben Fulton, the associate at in state policy for the Pew-MacArthur Results First Initiative, has also served as the policy analyst for the Montgomery County Council in Maryland and has previous experience working in state government. Amalia Mejia at CSAC is the coordinator for the Results First project, and her past experience includes conducting research and policy analysis for families in school and conducting research on criminal justice, education, and immigration policy. She received her Master's of Public Policy from Pepperdine University. So as you can see, our presenters are perfectly placed to tell you everything you need to know about the program. And now here is Amalia.
Thank you, Jeff, for the introduction. I just want to do a quick overview of the discussion. Today, we will be going over the CSAC partnership, the Results First approach, and then Kern will be sharing their experience in partnering with Results First. As you know, 2011 realignment shifted responsibility from the state to the county. This shift impacted longer jail time, higher risk offenders in county custody, and the need to reduce recidivism. With the lack of resources available, counties need to be frugal and pragmatic about where they invest their money. As a result, CSAC has partnered with the Pew-MacArthur Results First Initiative to build a technical assistance hub in efforts to support county leaders to engage in evidence-based policymaking. We have been assisting current partner counties in an ongoing assistance and will assist in the expansion to other counties. We understand the diversity among counties and the different needs of rural, urban, and suburban counties. The Results First approach, which Ben will cover in a minute, is broken into 3 parts. Because we know that not every county has the staff availability to complete the entire model, we are providing technical assistance such as navigating and using the Results First Clearinghouse database that can help answer questions about evidence-based programs in a variety of social policy areas like adult criminal justice and substance abuse. The Clearinghouse is a great resource and available to everyone. It compiles 8 clearinghouses into one. CSAC will also be assisting counties to create the program inventory and customize the Results First benefit cost model with county data to help inform adult criminal justice decisions. Counties would begin in the adult criminal justice policy area but could expand to juvenile justice or other social policy areas. The Results First model provides tools for counties to use when making data-driven decisions. Ben will now cover the Results First approach.
All right, well, thank you, Amalia, for that introduction. And as she mentioned, my name is Ben Fulton, and I'm an associate with the Pew-MacArthur Results First Initiative. And as you can tell from that really long name, we are a joint project of the Pew Charitable Trusts and the John D. and Catherine T. MacArthur Foundation. And what we are is a national initiative that partners with select states and counties across the country to provide them with the tools and training they need to engage in evidence-based policymaking, which at its core is an approach to governance that seeks to bring more evidence and research about what works into policy and budget making processes. As needs continue to outpace revenues in many parts of the country, more and more jurisdictions are looking for opportunities to use data and evidence to make more strategic investments with their programming resources. But unfortunately, policymakers often lack basic information about what they are currently funding, how it compares to alternative interventions, and what those programs they're funding deliver in terms of a return on investment. That's where Results First and the Results First approach to evidence-based policymaking comes in. So it relies, as Amalia mentioned, on 3 key components. First, as any good financial advisor would tell you, before you can make smart investments, you first need to understand your current spending. Results First helps states and counties do this by helping them develop comprehensive program inventories. Once built, this program inventory serves as an important but rarely seen snapshot of all the programs you're funding and operating in a given policy area, like criminal justice. Their participant, budget, capacity information, as well as a number of other data points, and what their research says about the level of effectiveness of those programs. The program inventory is an extremely valuable tool and has allowed states and counties to make significant change, some of which you're going to hear more about in more detail from our Kern County partners. But the inventory also sets the stage for running benefit cost analysis using the Results First model. This model combines the best national research on program effectiveness with jurisdiction-specific population and fiscal data to produce return on investment statistics for programs with a strong evidence base. This allows you to make an apples-to-apples comparison of various investment options. So being able to understand and compare programs based on what they deliver for each dollar invested may be common practice in the private sector, but it's a tool not often possible and achievable for governments when looking at social programming. That's where Results First comes in. And finally, Results First provides support to jurisdictions as they put this information to work for them by using their program inventory and benefit cost findings to target resources to effective and cost-beneficial programs that meet the specific needs of their community, answer the questions that are important to them. I think it's really important to stress here that Results First is a capacity-building initiative, and it does not advocate for any specific programs or policies, but seeks to provide the tools and training that you need to use this work in an ongoing way to support your communities. So to bring that all together, the Results First approach focuses on identifying current spending with the program inventory, considering whether the benefits of those programs outweigh their costs using the Results First model, and then finally using that information to target limited taxpayer resources at programs that work and are likely to be cost beneficial and get you the best bang for your buck. So as Amalia mentioned, the Results First approach can be used in criminal justice, but it is also can also be applied to a growing list of social policy areas. Although we strongly recommend our partners begin working in adult criminal justice because there's a lot of linkages between that system and the other policy areas that you can see surrounding it there. For example, research shows that individuals who suffer from mental health issues are more likely to be involved in the criminal justice system. Also, we know that investments in effective early childhood education can reduce the likelihood that that child becomes involved in the criminal justice system as an adult. Therefore, to understand the full spectrum of benefits resulting from programs targeting these other policy areas, it's really helpful to have already built the inventories and the benefit cost model in adult criminal justice. So far, as Amalia also mentioned, all of the counties we are working with have begun in adult criminal justice, but Santa Cruz just recently became the first county to begin developing the juvenile justice component of the model. And this list will only continue to expand as both rigorous research catches up in additional policy areas and as we seek to meet the needs of our state and county partners. So I keep saying partners, who am I talking about? I'm talking about the 22 states and 5 counties on this map, including the 4 California counties you can see on the left that make up the Results First family. Each has its own geographic, demographic, and political settings that make it unique. And when I say we're working in all these jurisdictions, I mean that we're helping them build their own capacity by providing them with the tools, technical assistance, and training that they need to engage in this approach in an ongoing way. We're not your typical consultant where we come in, take a bunch of your data, analyze it in a black box back here in DC, and come back with a report in 6 months that'll collect dust on your desks. Instead, we work with your staff on the ground to develop a county-specific model and program inventory that stays in your county and can be used to tackle the unique challenges that you face. To do this, we provide the software, train for the model. We train analytical staff, provide ongoing technical assistance both in person and remotely, and meet with county leadership throughout the implementation process to think through the policy and budget questions that this approach can help address. And just as a kind of FYI here, you can see that the California is blue there as well as the counties that you can see broken out. And that's because we recently began working with the California Department of Corrections and Rehabilitation, CDCR, to inventory state programs and build a state-specific benefit cost model. But that's enough about the states. They're boring. We all know all the action happens in the counties. As you can see here, the 4 counties listed, Fresno County, Kern County, Santa Barbara County, and Santa Cruz County, were the first 4 Results First counties. Before that, Results First had only been partnering with states. So this was really a test to see where this approach could work at the county level. And the results of that test have been really incredible. The 4 counties you see listed there have made tremendous progress in developing and using their program inventories and Results First models, and have really developed some really unique and interesting strategies for using this analysis to inform program planning and budget development. The case study you can see here pictured on the right of the screen has a lot of great information about all the different work happening in the various counties. But I think the best way to really understand the impact and power of the Results First approach is to hear from the counties themselves. So I'm going to turn things over here to the folks over in Kern so that they can talk about their experience and get a chance to answer some of your questions at the end. So with that, I will turn things over to Kern.
Thank you, Ben. This is Cassandra Friedberg with the Kern County Probation Department. Basically, the first question everyone asks us is, why did Kern County decide to partner with Pew-MacArthur and join the Results First Initiative? And basically, Kern County is a very high needs population. We are the 11th largest county, but we're the 10th poorest. So that means that we have a number of needs here in Kern County and very few resources. So we really needed to get the biggest bang for our buck. And Results First really helped us in pursuing that goal. Programming is in very high demand. And so we have to ensure that we're providing the proper programming to the right individuals at the right time. So what Results First helped us do is they helped us develop a program inventory. Prior to Results First, we did not have anything like this. There were a number of departments that had internal program inventories, but we didn't have one county-wide program inventory that we could all see and we can all share. So we developed a comprehensive program inventory, and this is a snapshot of our program inventory. And as you can see, it shows the % of our total program budget. And when we first went into this project, we thought that most of our programs were either going to be promising, maybe in the gray area, and we were only going to have a few in this green effective area. And we were very pleasantly surprised to see that a number of our programs fall into the effective category, and that we were actually directing about 90% of our program budget towards effective programming. Another huge goal that we were able to achieve through the Results First Initiative is a cumulative recidivism rate. Prior to this, we had a number of varying recidivism rates. We would look at a specific population, and we would follow them maybe for 1 year, 2 years, up to 3 years. But we didn't have a Kern County recidivism rate. And so this was something very important to all of us. It was just a piece of information that we just simply did not have. And knowing where you're starting is very important whenever you're looking at where you want to go. So you need to have your starting point. And that's something that was very important and very useful for us. So as you can see here, after 6 years, approximately 60% of our individuals were reconvicted of either a misdemeanor or a felony conviction. Now this is the slide that everyone wants to see. So what did you get out of it in the end? And this shows our projected recidivism reduction versus our cost per participant. So after we pulled all the data together and we put it into our model, this is what it showed us. It showed us that a number of our programs are right here where you want it to be in the upper left-hand corner. So basically our cost per participant is relatively low, and then our recidivism reducing, our projected recidivism reduction is rather high. And as you can see, we have our day reporting centers that over here, it's, you know, its recidivism reducing power is rather high, but its cost is also high. But that's because our day reporting center is like a one-stop shop. We have a number of services in our day reporting center, including substance abuse treatment, MRT, ART, employment services, education services, all of these services in this one location, and it just costs a lot when you have all those services all wrapped up into one. But even though it's a little bit on the expensive side, it also has the greatest potential to reduce recidivism. A number of our other very important programs are all kind of clustered right in here. As you can see, our correctional education, that has a rather high recidivism reducing property, and it's also relatively inexpensive. Our vocational education, electronic monitoring, and intensive drug treatment in custody, our costs are all relatively low because we're able to provide those services within the jail, and so we already have the overhead covered and all of that, so the cost is then reduced. So now we'll go on to the changes that have occurred in Kern County, and I will hand it over to Ian Silva.
My name is Ian Silva. I'm the lieutenant of our population management section, and that's the section that involves the coordinates inmate programs. So I come at this from a slightly different perspective in two ways. Number one, I'm more focused on the operational aspects of how to deliver these programs in custody. But additionally, I only took this position in November, or was moved into this position in November, so I come at this as something of a newcomer, but I'm essentially the beneficiary of all of this. This tool and these charts existed and were in place by the time I got here, so I got to simply use the tool to look at how we're going to move forward with our programming. So just to talk about some of the changes that occurred in our county as a result of AB 109 and our involvement in Results First. The first thing I'd like to focus on is the increase in collaboration and communication amongst our agencies. We have several partner agencies that work together to deliver our programs. That's some of the key units are our probation department, the sheriff's office, mental health, our employer training resource. That's just to name a few of the agencies that are involved in delivering these programs. And all of these agencies had good working relationships. If we needed to call another agency and get some information or help out or get some help with a particular problem, that wouldn't be an issue, but it wasn't necessarily our first instinct. Prior to my involvement in this area, this field of program delivery, I would talk to someone from probation maybe once every 2 or 3 months. I think since I took over in November, I've probably talked to my probation counterparts at least once a week, if not, when we got something going on, sometimes daily. So sometimes with different agencies working on things like this, you think you're collaborating until an outfit like Results First comes along, and because we're all working together to provide the data and the information to take advantage of that Results First model, we realized that there are gaps in our collaboration, and that process kind of forced us to get really tightly knit to make the whole programs area work better and move forward. The other thing it did for us is it really got the different agencies talking in the same language. Results First, by doing a cost-benefit analysis, really allowed us to speak in terms of the same unit of measurement. When we talk about a program being effective, we're really talking about the same way we came to that conclusion through Results First. The other thing is, everybody knows that a big key of realignment is making sure that we're making good use of the realignment dollars we had. As Cassandra said, we're not a resource-rich community, so to speak, so we need to make sure all of our dollars count, and that's something that Results First really helped us hit hard on. So moving on to the next slide here. Beyond the larger changes in the county, I wanted to highlight some of the changes that the Sheriff's Office underwent as a result, again, of AB 109 and our involvement in Results First. And this is not only just to highlight the Sheriff's Office program, but just to use this as an example, keeping in mind that a lot of what we do in terms of programs and service delivery to our participants is done in partnership with probation, mental health, and some of those other agencies I mentioned. So just because I say it's a Sheriff's Department program, we're not the only ones involved in that program. We have help from our agencies that we've become so tightly involved with. One of the things Results First allowed us to do is see the effectiveness of some of the programs we already had in existence. Before we got into realignment and Results First, we were much more heavily weighted towards education and vocational programming. Now, as you saw in the chart Cassandra showed just a few minutes ago, those programs are cost effective. They showed up farther in the upper left hand of the graph, where it shows it having a positive impact but being fairly inexpensive relative to some of the other programs. But we knew, so it was good to get that assurance that those programs were valuable, and it allowed us to kind of trim some programs that didn't really fall under that umbrella of effective programming. We knew, everybody knew going into realignment that evidence-based programming was going to be the direction to travel, but one of the things Results First did for us was allow us, rather than have a vague direction that we were going, really help us narrow down to a specific path or a specific roadmap of where we needed to go. One of the things my predecessor told me before I took over here was that we had evidence-based programming prior to Results First, but the clearinghouse database that Results First gave us access to and allowed us to work with really gave him a menu of options from which to select even better programming. So some of the programs that we have today may not show up on that graph because we didn't implement them until after that analysis was done. But the data and the program listings that existed in that clearinghouse allowed us to start picking and choosing even better programming that hopefully will show up to be just as effective or more effective. We're pretty confident they will show as effective or more effective in the next round of data when we start looking at this in a second round. We are much more heavily weighted towards that cognitive-based therapy or treatment as opposed to the education vocational. And I think we've struck a good balance, and I think we're ultimately going to show that when we go on to the next round of data analysis. One of the evidence-based programs that I wanted to kind of focus on, and just to give an example of the kind of programs we're running and the effectiveness we're seeing, at least preliminarily, one of our flagship programs is called RSAT. It's a grant-funded residential substance abuse treatment program where we house a group of inmates together through the entire treatment process. It's a 90-day program. And as you can see on the PowerPoint slide, we've incorporated a lot of the evidence-based programs or evidence-based curriculum that we found on Results First database or clearinghouse into that RSAT program. So that's where we're getting this. Surely we internally could have, I guess, in the long run, done the research and figured out, through raw, to be crass, Google searching to find out what programs would have worked, but we don't have the research capacity that Results First has to really show these programs are validated. And as we know, with a more emphasis on demonstrating results and progress in delivery of our programs, it's really important to have that assurance from skilled evaluators to know that the programs you're choosing and selecting and funding really are going to provide some good outcomes. And as you can see at the bottom of the slide, our RSAT program, we have about, preliminarily speaking, about a 22% recidivism rate out of that program. Now it's only a three-year-old program, so we don't have that level of six-year tracking that we had in the recidivism data that Cassandra showed you earlier, but again, preliminarily looking very promising. The last thing I want to discuss really briefly, and then we'll turn it back over for control here to the question and answer session, is where we are kind of looking to go moving forward. And obviously the first point there we want to focus on is integration. One thing that close collaboration between the agencies has allowed us to do is to really start looking to avoid duplication of effort. If I'm running a particular kind of program and probation is running a particular kind of program, we're closely knitted enough at this point to really be asking each other, hey, do we both need to be running this program, or can we knit these programs together so there's a continuity of care or continuity of services going from the in-custody portion into the out-of-custody the supervision portion of these services. Again, just laser focusing in the future on evidence-based programming, just increasing the weight of programming so that our vast majority of our classes really do fall under the latest evidence-based models, and keeping that updated as we go forward, because as more programs get evaluated, there's going to be more options out there, and we want to make sure we're taking advantage of those. And the last thing, the area that we're really looking to move into now is program evaluation and program fidelity. Until you're evaluating your own programs, when we talk about evidence-based, we're talking about the class is effective if it's delivered in the way it was designed and the way it's recommended to be delivered by the people who developed the curriculum. And when we go back and start evaluating our programs and making sure that we really are delivering them the way they are, the way they're meant to be, and that they're having the impact that they're supposed to be having, will help us really fine-tune those programs. And all of our partner agencies are moving towards increasing our capacity to evaluate our own programs.
Real quick, I just wanted to throw our contact information up there. And if you go to our webpage, there are a number of reports that you can get more information from. We have our 2-page report on there. We have a number of PowerPoint presentations that we've given on Results First to our Community Corrections Partnership. And as I mentioned, there's my contact information and also Ian Silva's contact information.
Thank you, everyone. I'll go ahead and I'll go ahead and ask the questions. And one of the questions is, how did the recidivism rate increase so greatly over the 5 years if they were employing effective programs? It doesn't make sense. Was that not what the previous slide showed? Cassandra, can you go a little bit over go back to the slide and explain the base rate for recidivism? Okay, so in order to collect the information for this slide, what we did is we developed a cohort. In 2007, 2008, we took every individual that was granted felony probation, and then we tracked them for 6 years. And so after 1 year, 21% of individuals committed a new crime, whether it was a misdemeanor or a felony. After 2 years, 38% of that cohort committed a new crime, and so on and so forth until we got to the 6-year mark. And after 6 years, 60% of that original cohort had committed a new either felony or misdemeanor crime.
And I'm just going to jump in here really quickly from the Results First side, and just make it clear that this cohort, this recidivism curve takes place, as Cassandra mentioned, from 2008 up until 2014. And what this does is establish a baseline for recidivism, so that Kern County can understand kind of where they are in terms of recidivism, so that when they, the way the model works is by applying the effect size that's determined from the research to show how effective a program is at reducing recidivism, to move to, when you apply that to this curve, to see how that curve shifts. So if it's a program that reduces recidivism by 10% over that time period, you would see that that recidivism curve shift down. And what the model does is monetize the value of that shift. So by reducing the amount of recidivism, you're also reducing the amount of resources used. That's less bed days used, court time, all of those things. And so that's how the model is able to monetize the value. It's also monetizing the when there's that crime's not being committed, there's also not a victim being created. So that's really how the model monetizes the value of reducing recidivism, and then compares that that value, that benefit, to the cost of providing that program. So I just wanted to make that clear, that that's the real importance of the recidivism rate, is establishing a baseline so that you can understand what implementing an evidence-based or effective program would do projecting forward.
Perfect. Thank you, Ben, for answering that. So going to the next question, can you describe what intensive drug treatment in custody treatment modality is?
Intensive in-custody drug treatment, is basically courses where we have the participants or the inmates are in class usually anywhere from 30 to 40 hours a week. It's most of the day, so when we say intensive, we're talking about time period, and it's delivered by mental health staff. We do have deputies who are assisting in the delivery of the curriculum and coordinating the class, but mental health are the ones delivering that treatment course.
All right, thank you, Ian, for that. The next question is, were there any programs eliminated after the study?
So there have been a couple of programs that have not been funded after this study began, but before we published the results. I don't believe I have the names of them in front of me, so I can't tell you exactly which programs were effectively eliminated due to limited resources.
Thank you, Cassandra and Ian. And I do want to clarify that the results that you get from the model are definitely a county tool to help you make those decisions. CSAC nor the Pew-MacArthur Results First Initiative pushes for any of that. It's really just more of you having the tool to see what program is effective or not effective in your county and you making that ultimate decision. Going into the next question, how did you project the estimated recidivism reduction rate for each program?
So I'll go ahead and take this question. So obviously when we want to understand the impact of a program on recidivism, the best case scenario would be a county-specific evaluation. So in the example for Kern, if they had an ART program and they had a rigorous evaluation done of how it reduced recidivism in Kern County, that would be obviously the best, and that effect size from that study could be used in the model to project how that program would perform going forward. But in the case where that isn't available, what Results First has done is taken advantage of an extensive work being done by the Washington State Institute for Public Policy, or WISP, who conducted an extensive analysis of the best national research that's out there about program effectiveness, and then took those multiple evaluations, so something like drug court's been evaluated, I believe, over 60 times, and aggregated those outcomes across a number of studies. So without getting too in the weeds here, what that does is produce an average effect size, so that, for example, if you're running a cognitive behavioral therapy program, based on the best research that's out there and aggregating those outcomes, you can estimate that that program would reduce recidivism by a certain percent. I'm not sure what it is off the top of my head, but what Kern County is able to do is say, if we were to run that program as it was designed with fidelity to the treatment model, we could expect a similar impact on recidivism. And so that's kind of how the model works. But we, as the Kern folks talked about, we've seen a number of our jurisdictions prioritize certain programs for evaluation so that they can get a Kern-specific recidivism reduction figure to input into the model. But in the case where that's not available, because those are really expensive and very time-consuming, we've seen a lot of states and counties take advantage of the best national research about how effective programs are at reducing recidivism.
Thank you, Ben, for answering that. The next question is, when you talk about being capacity building, how do you achieve that when the CBOs operating in the county are limited with numbers, experience, and evidence-based practice implementation?
Cassandra, do you want to talk about the current example? I can talk a little bit generally about the Results First kind of experience in other states and counties, but I think it would be interesting to hear the Kern side of things.
When we're talking about capacity building, Results First is coming in and they are helping us understand this information so that we're building our own internal capacity to utilize the model and all of the research that they make available to us. Then it is our job as a county to then go and build our capacity, our program capacity. So whether that's through utilizing community-based organizations or providing services in-house. So Results First builds the capacity within the county for us to utilize the information, and then using that information, we have to then go out and build capacity, program capacity. So one way that we have done that is the Kern County Probation Department has decided to develop a adult programming unit, and so we will be offering a number of programs such as ART, MRT, Thinking for a Change. We'll be using ethics, and that's one way that we are building our capacity to provide cognitive behavioral therapies to this population without having to use more community-based organizations, because we simply don't have enough community organizations to provide those services. So the way we've addressed it here in Kern is our departments have started offering a number of those programs in-house.
And just to piggyback off that, Cassandra, I just wanted to, just from some of the other counties that have a little bit more, maybe a richer base of community-based organizations, we found that in states and counties that where that's the case, where a lot of the programs are contracted out to those organizations, that that the best approach has been to bring them in early in the process, talk to them about what this approach is and how it works, what it does do, what it doesn't do, and really bring them in. We found that community-based organizations really want to provide effective programming, and so that they can be a real ally in this work in trying to figure out the best way to provide effective programming and set up contracts that have some performance measures or have outputs as well as outcomes reported, as well as just bringing them into the overall process and understanding that this is really about a cultural transition to thinking more about evidence and cost effectiveness, and that kind of capacity building, as Cassandra mentioned, that Results First brings to the county, that's a really important thing that the county then brings to the community-based organizations.
Thank you for answering that. The next question is, does your program include a family reunification component? And I'm assuming that this is probably the model itself, asking for if the model itself has a part of family reunification component.
That's something I'd love to follow up with the person that asked it offline. I don't want to speak out of school here. There's a large number of programs that are available in the model, and so I'd love to check back in offline and answer that question for you. Sorry, that's not super helpful right now.
Okay. That's fine. I can get you the information. Thank you, Ben. And the next question is, what is the screening or selection process for the 450 defendants attending the in-custody program, or is there one? Is there any separation in housing?
Yes, we use formal risk assessment screening tools that are validated nationally, like the offender risk needs assessment program. And one of the nice things about some of those assessments we use is, and this is part of that collaboration between us and Sheriff's Office, is we're able to get some of those risk assessment scores from probation. When a client from probation reoffends and ends up in our custody, we can use that information as part of the screening. And then we have our own deputies. We have program deputies and program specialists who actually assess the inmates for criminogenic needs to determine what the right program in our menu of programs is. And just to clarify, that 450 that group of 450 is that one particular program, and those inmates have been selected through that assessment process. And as far as the housing, in that particular program that I mentioned, the RSAT program, it is the basis of that model is segregated housing. So we do have an individual housing unit where all of those offenders that are going through those programs, they go through the program together and then they house together for mutual support.
So going into the next question, do you have specific information on the recidivism rates of your realignment population? How do these compare to your overall cumulative recidivism rate chart?
We, in the Sheriff's Office, we are tracking some of those realignment offenders, particularly through our RSAT program. We've partnered with a local academic partner who's doing a statistically valid study, or statistically rigorous study to determine those recidivism rates. And like I think I mentioned in one of the earlier slides, our preliminary data is showing about a 22% recidivism rate amongst the offenders who come out of that particular program. Now, that program, or the bulk of our programs, don't have so many years of tracking under them to match the 6-year recidivism rate that our baseline is operated on. So that's obviously a goal for the future, is to continue tracking them. So we'll have a full 6 years to compare to our pre-alignment tracking that the baseline provides us. But for right now, if you were to, for example, look at that 3-year mark where the original chart shows us at 48%, at least in the program that we've got an academic tracking and doing statistical studies on that is showing about a 22% as opposed to that 48%. Being early in the program, those need to be considered preliminary results, though.
Thank you for that, Ian. The next question is, at CDCR, we, and not we at CSAC, this is just reading off the question, found that an in-custody treatment was far less effective if the individual did not continue drug treatment in the community. Can you look at that?
Yes, our RSAT program and a lot of our programs actually do have continued treatment in what we call aftercare, continued treatment once the inmate leaves custody. Our mental health department provides that service for us. So we do have to follow up, and I agree with that. If we were to stop at the in-custody process, I think we'd see much less effective results.
Can you share with us specific risk assessment tools you use?
So I'll leave that to the current folks if they want to talk about the different risk assessment tools that they use. Obviously, states and counties across the country all use a very different set of risk assessment tools, but would love to pass that back to the current folks.
So we use the offender's needs risk assessment through Noble, and we also use the offender
static needs risk assessment, which is another assessment tool we use, and we also use the Virginia pretrial risk assessment tool as well.
How long does Kern intend to utilize this model? Is this an ongoing initiative?
Yes, this is an ongoing initiative. So what we've presented today and what we've presented to the CCP in the past is basically our first round of data, and we are planning to start updating all of that information in the summer, because while we were collecting all of our data and populating our model, there were a number of key things that changed here in California, such as Prop 47. That was huge. That completely changed how we sentence individuals. Obviously, that took a number of wobblers that could have been misdemeanors or felonies prior to Prop 47 and made them all misdemeanors. And so that will change our data. That changes how each of these individuals will move through the system. So we are in the process of updating it. We see this as an ongoing project, and it's not something that we're just doing so we have a nice report. It's something that we're incorporating into all of our departments, and we plan to continue to utilize this information on an ongoing basis.
Thank you, Cassandra. What does it cost to implement the results first model in a county?
So, that's a really great question, and something we should probably lead with. Results First does not charge counties or states to be part of the initiative. What we do is there's a mutual assessment process that happens between counties and states and Results First to understand if there's a good fit there. But ultimately, the boards of the Pew Charitable Trusts and the MacArthur Foundation really believe in the power of evidence-based policymaking and its impact in states and counties across the country. And so they've put forward the resources for folks like me and my colleagues to help states and counties do this work. I would say that the thing that is important is that a partner jurisdiction bring forth both the political and technical support to be able to do this work and be willing to dedicate the staff time necessary to build these tools, because as Cassandra just mentioned, we're not there to do a one-off program evaluation or come in and do a kind of one-off thing. We're really there to help build long-term capacity so that you can do this in an ongoing way. So at this point, there's no charge from Results First except for a commitment to both build the tools and use them, and also dedicate the staff necessary to undertake the work.
Perfect. Thank you for that, Ben. Can any of the data being tracked be correlated with homelessness? From
the criminal justice perspective, the main outcome we're talking about here is reducing recidivism, and so that's not something that is, there's a number of other outcomes that can be part of the Results First model and kind of putting out information, but right now homelessness is not part of the kind of criminal justice side of things. So hope that's helpful.
Thank you. And I will add that CSAC is working on a homelessness task force, and we'll definitely keep you guys updated through CSAC bulletin board with that. Next question, will there be opportunities in the future for other California counties to participate in similar studies through the Pew-MacArthur Foundation?
Yeah, so I think that's something that Amalia, you mentioned kind of up front. Results First has really had a ton of success with the 22 states we're working with, as well as the 4 counties out in California. And so CSAC has been a really excellent partner in doing things like this and having outreach to folks to let them know that there are resources out there to help them with evidence-based policymaking, and that's really where CSAC comes in and is developing a really strong technical hub to help counties in whatever kind of way is helpful for them. There's kind of different levels of assistance. Molly, do you want to talk a little bit about that? I think you mentioned it up front, but I think it's good to reiterate that.
Yeah, of course. So currently CSAC will be providing technical assistance and expansion to new counties from program inventory to the full model. And as mentioned, we completely understand that not every county has the capability or the staff capacity to do the full-on model, but just the program inventory in itself is a great resource to have to make, whether it's capacity, budget, and determining evidence-based programs. So if any of you are interested, please feel free to reach out to me via email or phone call, and I can definitely answer any questions and have one-on-one conversations about how the model works and what we can do to help you best meet the realignment needs and public safety issues. I don't see any questions. Oh, sorry, I have one more. Were you able to identify any effective programs for the mentally ill offenders?
So as of right now, we weren't studying mental health, the mental health section of it. We do have mental health professionals that come in to the facility and provide services, but I don't think we included any of that in our model as of right now.
Thank you for that, Cassandra. And just to add on, there is a mental health component to it. So as Ben had mentioned, the adult criminal justice is the first policy initially started, and then counties and other states are expanding to different policies.
Thank you for joining us for today's webinar, and thanks to our presenters for sharing their expertise with us today.